Could AI actually replace doctors in the future? Today, we'll dive deep into this idea and zoom in on one fascinating field, urology, where AI is already making waves in both diagnostics and treatment. AI in medicine isn't science fiction anymore. From radiology scans to predicting patient outcomes, algorithms are often faster and sometimes more accurate than humans. But medicine isn't just about crunching data. Doctors bring empathy, judgment, and the human touch that no algorithm can truly replicate. Yet. So maybe it's not about AI replacing doctors, but AI augmenting them. Let's take urology as a case study. This branch of medicine deals with the urinary tract, kidneys, bladder, and male reproductive system. AI is already helping here in powerful ways. 1. Imaging and cancer detection. AI algorithms can scan CTs, MRIs, and ultrasounds, spotting kidney tumors or bladder lesions earlier than the human eye. Prostate cancer diagnosis is also getting an upgrade. AI-powered MRI analysis helps radiologists detect cancer with higher accuracy and consistency. 2. Pathology. Instead of a pathologist spending hours under a microscope, AI can analyze digital biopsy slides, flagging suspicious areas of prostate or bladder cancer for closer review. 3. Predictive analytics. Machine learning models can predict which patients are at risk of kidney stones, infections, or post-surgical complications, allowing for earlier intervention. So in diagnostics, AI is like having a hypervigilant assistant, never tired, never distracted. But AI isn't stopping at diagnosis, it's also reshaping treatment. 1. Robotic surgery. You may have heard of the Da Vinci surgical system. Surgeons control the robot, but AI is starting to assist, suggesting optimal angles, reducing tremors, and in the future, potentially automating parts of procedures. 2. Personalized treatment plans. AI can integrate genetic data, imaging, and patient history to tailor treatment for prostate or bladder cancer, deciding who needs surgery, radiation, or just watchful waiting. 3. Smart wearables and remote monitoring. Patients with urinary incontinence or chronic kidney disease can use AI-powered wearables that track patterns, alert doctors, and even suggest behavioral modifications. 4. Drug discovery. AI is accelerating the search for new treatments, like novel therapies for resistant prostate cancer or more effective kidney stone prevention drugs. Now, here's the catch. AI still struggles with context. A patient's anxiety, cultural background, or subtle symptoms might not fit neatly into an algorithm. Plus, AI tools are only as good as the data they're trained on. Bias in datasets could lead to misdiagnosis, especially in underrepresented populations. And let's face it, when you've just been told you have cancer, would you rather hear it from a compassionate doctor or from a chatbot? So, will AI replace doctors? Probably not, but will it transform how doctors work, especially in fields like urology? Absolutely. The future isn't AI versus doctors. It's AI with doctors. Together, they'll diagnose faster, treat more precisely, and ultimately give patients better outcomes. What do you think? Would you trust an AI to diagnose or even operate on you? Drop your thoughts in the comments below. And don't forget to like, share, and subscribe for more deep dives into the future of medicine.